Bismillahirrahmanirrahim. Alhamdulillahi alamin wassalatu wassalamu ala asyrafil anbiya'i wal mursalin sayyidina Muhammadin wa ala alihi washabihi ajma'in. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Honorable Speaker, Associate Professor Dr. Nora and my fellow colleagues, professors, associate professors, doctors, brothers and sisters. Assalamualaikum warahmatullahi wabarakatuh. Get more barakah in this Holy Jumaat. Let us recite Kitab Al-Fatihah. Ahlan wa sahlan. Welcome to training on problem-based training and problem-based learning and project-based learning. I'm Dr. Mira, the MC for today's session. Let me do some introduction. Okay. So this is our training for today, problem-based and project-based learning from our speaker, Associate Professor Dr. Nora. Okay, jalan. I need to everything here first. I think it's there. Okay. Is it moving? Okay, these are our IIUM 7 mission statement. We need to map one of the mission statement to our training. And this training is mapped to the 4th mission statement, which is to nurture the quality of holistic excellence, which is imbued with Islamic moral spiritual values in the process of learning, teaching, research, consultancy, publication, administration, and student life. Okay, a few gentle reminders here. Kindly register your attendance at I attend. The link will be given soon. And fill in the evaluation form. After the training, we will again give you the link to the evaluation form for you to fill in. You need to fill in, to get the security point. And if you have any questions, you can unmute your microphone or you can write in the chat box. So welcome to the training, everyone, inshallah. So I'll stop sharing first. So I think I'll pass the session to our speaker, Dr. Nora. Tafadhali, ya ukhti.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good morning to all my fellow colleagues, esteemed professors, associate professors, lecturers, and especially from the CPD. So for arranging this and organizing this session. Initially, I thought that we can do in face-to-face or even hybrid, but I guess it's a good point as well to have it as an online because of after the Hari Raya festive, there's increase of infection, COVID here and there. So I think well, perhaps we have to go back to our teaching learning methods. And if you bear with me, because sometimes I have a dry and sore throat, just came back from KL last night for 2 weeks of becoming an examiner for our postgraduate psychiatry. And for your information, the postgraduate is using the National Conjoint Specialty Curriculum. So some of the university hosts certain parts of the exam, and it's such a quite tiring from USM in the east and to KL. There are several places as well. So alhamdulillah, with the helps and assisted the organizing committee, we can so-called share some of my experience and so-called I think it is, I'm not the best person to deliver to this topic, but I guess it is also some of you are very experienced in this using the problem based and project based. But I'm trying my best since I also um, as a psychiatrist, yeah, I'm a consultant psychiatrist. So we do see problems. Every patients come to us with problem, and to understand the gray area. For me, psychiatry is it is my friends always say that there's no definite tools, and we have to use all these we are seeing the mental so-called disorders and some patient with psychological disturbance, and we must have a good mental hygiene as well. So I think I would like to share the screen. Can I'm sharing there's some what's this? Mm, can see this or not?
We are only seeing your drive, doctor, not the
Wait.
PowerPoint.
Okay, jap. Can
PowerPoint bukan.
belum
Kita kita nampak ni file doktor.
saja. Nak banyak rahsia tu.
Uh-uh.
Wait, kenapa dia tak buka? Okay, we'll go back to share screen.
Share entire screen.
Yeah, maybe I'm not sure.
Okay, boleh.
Can
Can.
Aku nak jadikan dia PowerPoint. Slideshow. Boleh?
Sekejap.
I dah
Sekarang
test tadi. Can see or not the full? Otherwise, I have to use the one yang tadi.
sekarang we can see, however it's not in slideshow mode.
Oh, okay. This one cannot. Actually, my computer shows in the slideshow mode, but I have tried this now, and that means I have to use the so-called I think some of the system. Okay, while waiting for this. Is it okay if I just use this because of I think there will be a problem if I try to put in the presentation mode.
I think we can read the still.
Okay.
Still we can, yes.
Can? And please don't focus on the slide, but focus to what I am going to share. This the PowerPoint is to empower me. Okay. Right.
Okay.
Okay. So at the end of the okay, if you see if the slide is not moving, you just let me know. Okay. So can you see the learning outcome that I write down?
No, it's not moving. We are still looking at the first page.
Just give me Maybe Sister Dr. Vira can just go through the whatever you can say about our today, but I think I need to change to another format probably because of the computer maybe behind apa ni tak updated ke apa.
Oh, okay.
Sorry. Okay, actually I have tested some of that before this, but it doesn't make any problem.
It's okay, doctor. Take your time. Well,
I can take my time, but the participant may not be able to take it. This is what I don't like about technology. So I pause the screen. Let me. I'm sorry. I think we just need to go with this. The share screen.
share screen, share the whole screen.
Oh, share. Okay, share the screen.
Share yang kiri sekali.
Share. Can now is the in the kiri ni. Participant can see now, but how to make it work? Itu masalah. Sekejap sorry.
Okay.
Boleh?
Boleh? Nampak dah?
Learning outcome.
Yes.
Okay. Sorry. This is a usual, but although I've tested before this, so I hope at the end of our session we can know and define what is PBL, what is project based. Sometimes they put PJBL for project based learning, and we can at least have some ideas how to draft example of problem based or project based packaging or module, and how to implement and construct some assessment for both learning methods. And perhaps we can discuss on identifying some of the issues when we are doing the group work, and how the usual problems or difficulties in terms of to come up with a good assessment tools. This is at time I think can be quite difficult to construct sometimes from my experience. Yeah? So the same thing, component. So for those who knows about PBL, very well versed, just take it as a sharing as well. You can always give your opinion on this. And PBL, problem-based learning, history long ago in 1960s, and it started when we are using in our medical education. It is to shift from the traditional and to involve more on the students' participation. And the result from this, the traditional, from the history, that teaching little relevance to clinical practice. So since then, PBL was implemented, and also in health sciences. So I will focus today is about sciences, but I think it should not be just in the sciences, because we see problem, we hear problem every day. And I ever since I've started more than 25 years ago as a medical student, we are using the integrated so-called system, although I'm putting in some of the seeing the problems and get to work on that problem. And it's easier because of when the patient come to us as in sciences or as a doctor, usually we see the problems. What's wrong with the patient? And one presentation can be a presentation of many things. For instance, let's just look at in our daily life. We sometimes experience difficult to sleep sometimes, and we start to look for what is happening. Is there a normal? Is this normal? Is this abnormal? Yeah, difficult to sleep, and sometimes we also complain about we have headache, some minor things. And actually, when we look at this, it is a problem to us, and we need to find the answer. And as a human being, we cannot live in uncertainties sometimes. So we are looking for what's wrong with us, unless we are very we come to the stage of, we say, elogia, not motivated, unconcerned about the surrounding. There is a situation with the one time as a lecturer, we also can reach to the state of penat, burnout, and we started to have some emotion and concern, not motivated, just come. So this is a problem, I guess, for those who are having normal as a normal human being. So we looking at this, and we try to do some deductive, inductive, and comes with some hypothesis what's wrong with us, and it makes our minds work. And we have to use our mind, yeah, to think. If we do not use some of the nerve, I'm afraid that we're gonna get demented early. So don't worry about using the mind. as long as it's not excessive. So it is a student-centered and students-directed learning, SDM, and we learn through the experience to resolve a problem. There are some questions that leads to some of the investigation, and it is focused on hands-on experience, not just memorizing facts for our student. And we provide some solution to the question. And what is so good about this, because we are promoting higher order thinking, to synthesize, to analyze, and to come up with some solution to the problem. Sometimes we could not find the solution. What's the best solution? In life, sometimes we say there's no solution for them, but the process of getting the solution does matter. At the end of the day, perhaps we could not find the best solution, but we said that is the appropriate solution at that particular time. So the problem-based learning that we teach to our students, it's not just for their academic purposes, but I always think that this is the best for the lifelong learning. You learn from experience. Then we can, it's also a form of inductive learning, because we induce some hypotheses, some ways of how to help with the problem. Okay, just simple examples that I am from a small kampung, and I do not know how to. Last time we go to school, but at the same time, our parents, for instance, me, asking me and teach me how to be independent. So I think that the experience that I have actually give me some resilience for who am I now. So that's why, because of the experience that go to went to paddy field, the rice field, and see how they don't have their objective is all in their mind. You must learn how to live. Okay, but because the problem-based learning, the problem now that I can see that if we have problem, we can manage. Although the solution probably we can't get the best solution, but the process. That's why it's not just for the academic purposes, but it also for the life, and then to promote our the cognitive, the affection, the emotion towards what we are. And psychologically, we said that learning through experience are much more impactful in terms of the memory as well, because some of the things that we go through that process, discussion, everything is actually using all the senses, visual, auditory, visual, the vision, the listening, the sensation. We got to feel and we got to see a discussion. Lots of emotion comes in with when we are trying to solve a problem. When involved with a small group, so sometimes we learn how people how to be critic, how to not how to respond, how to develop our resilience skills in terms of if our idea is not being accepted. So this is, I think, that being in our generation now, as well as for us as well, we can find that if we discuss, and we will get better conclusion or better solution. So the new learning also can come up with from the problem-based learning, right? So this is some of the objective of PBL, and this objective later on probably we need to the outcome of this problem base is needed so that we can construct a better assessment tools. Acquisition of knowledge for the fundamental. So in sciences such as health science, like health sciences, Kuliah of Science, the science, engineering science, so the fundamental and clinical practice. So we acquire certain knowledge by ourselves, whether it's fundamental, and to bring and apply into our into the real life situation when the students work. For instance, like in Kuantan, it's all the science campus, and I think engineering is also so-called pure sciences. But because I'm from medicine, so I think maybe most of my example is clinical, and I think we work together. One of the good things about PBL is actually we also encourage the student to have interdiscipline discussion. For instance, to solve a problem of a patient who comes in with stroke, stroke. So in giving the best treatment for them, we require nutrition. We require the physiotherapist. We require the radiographer. We require the nursing staff, the nursing, and we work together. And we can't say that only doctors do this, do that. So when we do the problem-based learning, we cannot always extend that to the interprofessional involvement as well. And in fact, that it is always in line with what Islam said to us as well, to do musyawarah, to discuss whenever we want to achieve one decision. So what are the skills that we promote? Critical thinking. The students critically analyzing and try to solve the problem by looking at different ways. It's not only one way to solve a problem. There are many ways. So similar like in any situation, to go to Jannah, we have many ways to go there as well. So problem solving skill, and then we offer problem skill in solution A, solution B, and the student or we make a decision based on some other critical thinking. So what are the soft skills that we can get from problem based? Because it is a group work, so we can look at the on the attitude of professionalism, the soft skills, the leadership, because we need to identify who is the leader. They need to identify the leader, and it is teamwork. How do they communicate? How do they talk? How do they achieve the critics from the peer evaluation, and even to promote the good interpersonal skills. I think as a psychiatrist as well, sometimes I do receive cases from our student in Kuantan, not just medical student, but some of them have interpersonal issues when they are and these interpersonal issues becoming more prominent when they have to do a group work. You can see some of them just keep quiet, couldn't be bothered as long as the job done. some of the students very stress, I can say stress, because of the the personality. I mean, some will have obsessive kind of person, so they wanted to do things according to theirs. Some are laid back, so couldn't be bothered. So to match and to blend into this personality will be depend on what are the skills that they have gathered throughout their life and the learning experience. Any so far, any other thoughts? Because of otherwise, the online one will be quite dry and ada banyak chat. Okay, stop sekejap. Okay. All right. Oh, so PBL, problem, what need to learn and apply. I think another one is about, so I use this slide for face-to-face training. So sometimes we got people to talk, but since we are online, why we use problem to learn? What comes in your mind when you heard the word problem? So these are the questions that when we heard about problem, the words problem, do we take it as a positive or will be a negative? Or when we heard about the problem, we said we want to solve the problem. And it is quite interesting as compared to we are in the medical or health and sciences, people comes to us with a problem. They don't come to us when they are well. So as a psychiatrist also I usually say, for me, no news means good news. I used to make jokes to my friend. So whenever the call comes and the message comes to me, I say, okay, what is the problem? So no news means good news, probably. But so that's why we are trained to look at the problem and to try to solve that. In fact, when we synthesize any problem, we said the number one, number two, number three is what are the problems for this patient? So it will involve psychosocial. The bio part is the diseases that they have. The psychological part, and the social part, what had happened to them, to their life, the people around them, to their work. So it's all under one problem. Some people don't like to use problem. They say this is just an issue. So when is the issue become a problem? The issue of coming late to class, the issue of this. So coming late is just an issue, but it will become a problem when it's disturb the person or the surrounding. So as long as the issue of not having enough money, is it a problem? Some people say, no, I don't have a problem. I just don't have enough money. So what do? I can I'll live within my means. So that is an issue. But problem is when you have not enough money, we start to maybe to steal, to disturb people. So that's why some people say it's an issue may not be a problem. So when the words problems comes to me, I think we start to try to find a solution. So how do we approach the problem-based learning method? Because there are many ways of learning method, and I guess sometimes the learning last time when we have a lectures, is it not good? I think it still have plays some roles, but as I said, from the students learn by themselves, and if we keep on giving lectures to them, they probably use less neuron in the brain to promote the higher order thinking. But it is still good sometimes to just give some brief lectures and leave them with some homework or some. This is probably not the problem based, but there's maybe the team based learning. So problem, it is realistic and based on learning outcomes. So when we approach, we have a problem. This is a realistic problem, and the learning out. It must also be what are the learning outcome that we want the student to get after with that packages or with that problem. Sometimes I do think that when we do the base learning outcome also, from package to package, because the problem will come one after another. That's how we approach. There's always some learning outcomes specific from that particular packaging. I mean, the problem comes in and out. And it is a realistic thing that when we reflect to our life as well, we probably have one problem, for instance, stroke just now, but the other problem will come after that. So a stroke, cannot move, then we have to be on MCs. We do not know about our cognitive capacity, whether we can go back to work. So there'll be one after another. So each of the each time the problems come, we probably need to define our outcome again. Lecturer as a designer and facilitate the students, maybe sometimes put in some resources how to do as a guide. So we design, and student is a problem solver. So our job as a lecturer, as a designer, according to the learning outcome, we design the problem, and it is a realistic problem. A key learning principle in PBL is it is constructive, collaborative, contextual, and self-directed learning. The student do the job, the student presenting the job, the student teach their friends, and they come up with one solution.
Doctor, sorry, there is
Yeah.
a question in the chat box.
Okay.
From Brother Akmal Hakim. Assalamualaikum, Doctor. How does problem-based and project-based learning align with the current science curriculum and standards? Are there any modification or adaptation needed to improve these approaches effectively?
Okay. Soalan filosofikal ni. Okay, Dr. Akmal. Yep, actually the PBL and project-based are really one of the ways to achieve our curriculum sebenarnya, science curriculum. How? Because of it is structured, and if let's say our curriculum from which kuliah ya, Dr. Akmal? Yeah, I know. So that is easier Never mind.
No, I'm from Salpet, doctor. Salpet.
Oh, Salpet. Okay, sorry. Okay, good. So actually, if we have our curriculum and our learning is to produce a student who is holistically in terms of their professional Islamic. So we design the project and the problem according to and then we probably we need to align. That's the main thing is to achieve our curriculum objective there, right? Contoh, if let's say we want to produce the student with the professionalism, learn effective communication, and treat the patient holistically, bio, psychosocial, spiritual. So in the problem that we say, how do you approach this, the management probably? So the design of the project and the problem must be able to help to make the students to talk, so that and to go through some resources on how to treat patient in terms of spirituality, psychologically. So spirituality is not just for psychiatry or emotion. When we see a patient with even with selesema, with upper respiratory, with flu, now flu everywhere, flu, COVID, there's always the spiritual element as well. And our university is one of the objective tadi yang shared by Dr. Vira is to produce so what I'm trying to say here is Dr. Akmal, is the design. At the end, the student will need to go whether to read or to talk, to demonstrate their professionalism by applying this in front of the patient and in front of us. So we are going to evaluate that based on some rubric or some of the assessment terms. So that's the current science curriculum and standards. There's always standards lah for that. Okay, nah? Ada apa soalan seterusnya tu? There any modification adaptation needed? I think what we are having now, I'm not sure about other kuliah, but I guess it's almost similar like kuliah of dentistry. Modification or adaptation, yep. If we have not tried the learning methods, the learning strategies, because we have many learning strategies, but how? Let's say we just give lecture as a teaching learning method in the lecture base. Probably we can assess the communication skill of the students. So it will not align with our curriculum or any standards are given by MQA or any other professional bodies. So if we cannot if the whatever teaching learning methods now is not aligned, so we need to modify and to adapt, because the objective can be achieved in certain learning methods. Okay. All right. Okay. So actively construct and reconstruct knowledge. Constructive, yeah, because the student will construct their knowledge and reconstruct again if they find a new things on top of the first knowledge. So they will elaboration of facts. It's not just swallow the facts that they must elaborate and synthesize. And then the link with existing knowledge. Okay, this is where some of the students of us, we have some existing knowledge through our experience, through our reading prior to that. And so when we have the problem, we will link with existing knowledge, whatever that we have had. For instance, if we have the case of, if it is from self-pet, what are the usual problem, in that we can see in students with self-pet? Maybe the languages, self-pet language, if let's say, how can we have we design or we make a problem that the problem is a student or foreigner comes to Malaysia to study or just to work. So the problem is he or she didn't know Bahasa Malaysia, but he needs to know to use that to suit with the cultural, and it will help them in their working. So I remember that I used to work in Middle East. So the first thing that I tried to learn some simple Arabic, so because it will help me to help the patient. Then so we have this problem, so we try to solve that. And this is what the department, not just sciences, but for the other fraternity as well. Constructively, the knowledge also with the interaction with others who comes from a different background. So let's say I read about this, my friend read about this, the other student read about this, and we enrich the knowledge by interacting, listening skill, questioning skill, and what else that we can do? Lots of things. When we interact, our knowledge will be far better than just read alone. And it is also the collaborative interaction among individuals. So again, elaboration of the problem, mutual support, criticism, all participants must have the same goal. We want to solve one problem. So it is a shared responsibilities and need to be dependent on each other, and also allow open discussion. So the propagation of knowledge will be as good as, is better. I think it's better. We used to encourage our students to study in a group. And technically, when they are studying in the group, their result is actually much better than studies alone. And I've seen this in my practice as well. We used to compare some students and another student, even our colleague, also our friend. So they probably have a little bit difficult, although some of them say, oh, I prefer to study alone. I prefer to study with friends, but there's always need a mixture to get the best acquisition of knowledge. Problems are authentic, real. We cannot construct the problem which is not real. Perhaps if it is not real, it cannot be a problem-based learning. Relevant to the professional practice. If you are lawyers, you probably want to see the problems in the lawyers. The issue must be contextual and authentic. The issue can be complex, and learning happens to acquire and use the knowledge. So when the students learn when they acquire the knowledge and to use the knowledge. Self-directed learning, active role of the learners, planning, evaluating, reflecting, identify the knowledge gap and improve self or group progress. And they must be responsible of their learning process. So I think the last one, responsible of their learning process, it is very much of reflecting in terms of our life. So we must be responsible of what we are doing in the dunya, so that we will be questioned. And if you do good, you get the good result. I mean, you go to Jannah. If you do bad things, you go to hell. So that is the people are responsible. So if is it a responsibility of the teacher? Yes, but probably how good is the teacher if the person doesn't know how to use or utilize the best out of that? They will not they will not learn. So this is where we said that you are responsible. Is the university responsible? Yes, university responsible to provide you the avenue to this and that. The teacher is responsible. Yes, the teacher is setting the goal, the objective, and to see whether the learning process occur or not. But the student must be responsible. And then through this problem-based learning, we teach and we direct the student to find the solution for their own benefit. And with the help and facilitate and guidance, and I guess that's also reflect. We can reflect that we guide our children. We guide. We sometimes we don't give the solution for them, because the one solution for me probably is not suitable for you, because we come from a different. But we probably can have one mutual understanding, one solution that can generate, can be used in whatever situation. So the same thing that I think the problem-based learning is one of the way to help the student or the people to be responsible and to be accountable. And we must teach and train our student to be accountable and to be responsible, so that this is my decision. I have the autonomy. This is based on based on several opinion that I get from others. So I guess that is the bigger reflection of in our life, or the problem-based learning, and what do we get from this. But on the smaller size is the how to pass the exam and to come up with a person with holistically with the sejahtera, a well-being in for the biological, physical, and also spiritual part. Okay. So, any other question? Check. But so far, from doctors, any question or any thoughts or any point that we can give? Anyone want to share some things? We will still have time, Dr. Wira?
Yes, doctor. We have until 12.
And so many people use today. My problem is how to go to Hari Raya celebration. Because of the last 2 weeks, miss all the Hari Raya celebration, and because of the exam. Anyway, if maybe I can hear anything from engineering, from people from other kuliah who has done this. All these young lecturers, I think you are all the product of the PBL, problem based. Dr. Wira, anything that you want to share?
Okay. I think when I have class 3 hours class, I don't usually do the lecture for that 3 hours. So maybe after 1.5 hour or after 2 hours, the lecture finished. So I start with class activities. Some of the activities I also sometimes depending on the topic, like yesterday I was teaching this testing and assessment class. So I give a text to my students, and they need to create questions from that text. So I think that text becomes the problem lah kot.
The text is problem for them, but this individual or group work?
Group work.
Group work.
Group
Okay.
work.
Yeah. So yeah, this is a simple way. So we say we are doing some problem and try to, but for the to structure how do we structure? How do we do? Yeah, it's always a small group. I think it's 6, 7, not too big a group, yeah, because we probably have difficulties later on. So it's a smaller group, 6 to 7 people, or the most is 8 to 10. And I think that one of the issue last time that we face when we want to the PBL is the participation. We need to have facilitator. Let's say from Kuliah of Health Sciences, one batch is 100 pula ataupun any other pula. So 100 people, they need to be divided into, the most is 10. So we have 10 group of students, and we need 10 facilitators for that particular packages or module, the PBL. So it's not easy because of sometimes the expert for that PBL, probably the learning outcome is, let's say, to understand the most of anatomy and physiology of heart, probably, or to understand to get some knowledge on the, let's say, on the, if optometrist, maybe the structure, the anatomy again, the nutrition, the dietitian, probably they need to know what are the certain ingredients. So the knowledge here, perhaps we maybe rely on one expert. However, one good thing about PBL is when we construct the module or the packages, we get input from everyone, and so-called like a train for that module. So everyone actually can be a supervisor, provided they must know and well versed with that packaging, with that module. So a leader conduct tutorial, ensure all participants. So we need to make them choose who is the leader, who will conduct, and who will do the administrative job as well. For instance, communicate to all the members, how to book the room for discussion, how to make sure they're all participation, how do we divide the tasks to certain group of to a specific person. So a leader, so this is where we are producing a leader through the teamwork. Facilitator is the lecturer who can guide, intervene, bring them back to pangkal jalan. Sometimes the discussion has go on because they probably, some of them think out of the box, very out of the box, then become not focusing. So the facilitator, the lecturer, intervene and give feedback. There's no learning without giving feedback or reflection, because of this is one of the objective as well. I mean, the learning outcome is you know how to do some metacognition as well. You think and you reflect, ensure sufficient depth of the problem. We cannot be, if we do not structure it properly, we probably go not, being not so focused about the learning outcome that we want to have to happen. A problem is complex, open-ended, no right or wrong answer. Yeah, this is one thing that about no right or wrong answer, because the student will come with several solutions and problem. But of course, there's always one, there's no one way, but the student can suggest, we probably do this because of this, we probably do that because of that. So the students can give their opinion, their solution, but a facilitator must make sure that if the solution is not suitable, so they need to modify a bit. So this is the role of the facilitator. So how does it occur? So once the packaging the module or the problem-based module, probably the lecturer will 2-3 lecturer will work on one module on one package, and the problems will come in staggered. The first tutorial is what we give them one trigger, the second one trigger, and then we assign tasks. What are the learning issues that they need to get from the first tutorial to the second tutorial? So generally, first tutorial to discuss about the problem. What are the terminology that we do not understand? What are the situation what are the other information that we need to get in order to get to one of the diagnosis, or to come up with the problem, the solution. Use of whiteboard to record facts, idea, and learning issue. Learning issue is the knowledge gap that facts or ideas and learning issue is part of the knowledge gap. What are the students already know? What are the new things that they don't know? What are the things that they want to get? And once they identify the learning issues, then they will assign the task among them. We give them 3 to 4 days to do the learning, get to go for the resources, to discuss. And for the second tutorial, we invite them to present the use of new knowledge and to what are the solution, and then the evaluation and reflection. So at the end, it's always about reflection, because of muhasabah, reflect what are the things that they do wrongly for them, what are the good things that they did. So it's all about evaluation and reflection. And from the reflection, what's next that we want to produce? We'll go about the reflection later. So there's a session in the timetable, tutorial to discuss problems. So we give them trigger 1, PBL, trigger 2, trigger 3, and then for them to discuss and do the self-directed learning. And the second tutorial is for presentation of their finding.
Doctor, there is a question from Dr. Shahid
Okay.
in the chat box. Doctor, can you share with us the rubric which we can use to grade student? Is there any rubric?
Kita come to the assessment pastinya.
Okay.
Okay. Boleh minum air sekejap, Dr. Wira? Any other question so far? Actually, I need slide kosong ni because of I wanted to sorry. Proses ni. Okay. Jadi proses tadi just to simplify a bit. We have from the literature I share problem scenario, explore problem. Can you see this picture? Can?
Can.
Okay. Problem scenario, explore this now, generate facts or ideas, brainstorm, discuss current knowledge. What have existing knowledge that we know, and then identify learning issues, and we suggest learning resources. Then the student learn, then they rediscuss the problem, share and apply new knowledge, evaluate performance, consolidate learning, and prepare product. So 2, 1 and 2. Prepare product is actually the solution, what the management. And if let's say we find another, this is a circle because we keep on, we can always keep on adding if we want to, but evaluation and what else we need to do. Decision. That this is the whiteboard. Normally we want to the student to write. Now they use probably, that's why we need to have the physical, but I think all this also can be done in the form of non-physical nowadays, right? Because of you can have Zoom meeting and the whiteboard and the Zoom. Somebody need to subscribe, right? But we in medicine we still encourage the face-to-face. Now the current situation. However, I think we can modify. The thing is we don't we make sure that the student open their camera so that we can see the facial expression, the body language sometimes, because it can give some, and then the facilitator can point it out as a part of the learning for the soft skills. But we can try in doing that in the midst of COVID or infection. But I think now we still do the face-to-face for in our year 1, year 2. PBL, problem-based learning in medical, they usually use a lot during primary, the basic sciences lah. I think in dentistry, can use in health sciences. Or when they come to the practical part, the clinical, so every day it is about problem. So whatever the experience that they have during basic medical sciences, they bring to the clinical years, the practical years, and still the same concept, much more much use. I mean the use of this same concept, because when they come to clinical, they look at the reality, the problem is real among the client, let's say you are optometrist, you see initially is the problem based, just but when they come to the reality, what are they have to use the whatever existing knowledge to solve the problems. Okay, they present students engage in self-peer and tutor review. So this is the process. Present problem again, as students define, student engage when the students share information, present their solution and review what they have learned. Students engage in self-peer and tutor review of the process. Okay.
Another question, Dr. from Dr. Muhammad Rusdi. How much intervention is usually required during PBL? Intervention.
How much intervention? What can I say here is intervention here, is it to intervene the process, or we don't want the students to be like spoon feed, spoon feed. Yeah, okay. Guidance, yeah. So because we don't want to be seen as a spoon feed, spoon fed the student. So how much to intervene, how much to share? So our guide, as a facilitator, if the students fail to identify some of the learning issues, probably. So learning issues when the first tutorial. So from our discussion, we guide the student to look at and to get back. Do you think that is a problem here? What you need to, so then the student give, how do you want to get the information? So we always gave back to the student. How do you want to get, where do you want to get to the information? Maybe they say from Google, so we want them to have a scientific evidence base. So many of them now bring iPad in the classroom, iPad lah, tab lah, which is it is okay as long as they know what they are not looking in the Wikipedia. So we wanted some evidence to the student, how much we can intervene, as long as we always give back to them. If let's say, where do you want to get this information? How you want to get information? So always use the how, what, when. So how do you want to get the information about patient stroke? Or I'm going to interview the family or this, that they give the answer. So I think the guidance here is actually is really guide and for them to come up. Unless kita rasa they don't have, they can't think, but we need to tell them. So this is our role as well, to be, we are the resourceful person. The lecturer must be a resourceful person. So we can always tell them. If the answer, maybe they say, okay, you can check any hadith, you can check this Quran. Sometimes all this, because our university is one of the universities who has the curriculum on the Islamization of human knowledge. So I hope I can answer Dr. Rusdi. Okay. Okay. Example of PBL in medical school. So I took up some of the PBL, one PBL packages. I need to stop this so that I can share the example. Gambar tak boleh nak share pula. Okay, share screen. Ada nampak tak? Tak ada Ada, can you see the PBL package?
Tak ada, Doktor.
Tak ada Sekejap. Now?
Okay, dah boleh nampak.
Ada.
Okay. So, I think the Kuantan campus quite familiar with some of the term because we are from the health. But as I say, I think the PBL can be used in any form of teaching. Okay, this is the tutorial one. The package is a trigger one is the chief complaint, the problem that the patient need to solve is Mr. YH, a 37-year-old Malay man from Jaya Gading, was referred by his GP to the internal medicine department. Suspect at IUM with a 1-month history of lumps all over his body. So I think if problem in dentistry, they can construct similar like this. What about in radiotherapy? Radiotherapy, maybe the problem can be the problem involved with the patient as well. Or if very technical, that means we can use some of the scenario to help us. And this scenario is actually comes with problem, and each of the information here, 27-year-old, sometime from Jaya Gading, if it is some of the information is needed, the place or the location. For instance, if they are orang asli, they are coming from orang asli settlement, the problems that they are having probably more towards the common thing that can happen in certain population. That's why the Jaya Gading or some of the places are helpful. The remote area, for instance, whereby they don't have enough health facilities, so there will be a social problem in managing the patient later on. So the problem, the student's task, we identify, we put it in, what are the tasks of the student? Are there any term that you do not understand? Any of this term, they can't understand. For instance, SASMEC at IUM, maybe they don't, what is SASMEC? For instance, from internal medicine outpatient, because the trigger here is for the basic medical sciences. So basic medical sciences, they have not been exposed to the clinical department in the hospital. So any other time, maybe they don't know what is internal medicine outpatient. So they need to understand what, if I can see this, one of the learning objective is to understand the hospital management, which is required for the students in medical medicine to understand, so that they don't refer a wrong patient to a wrong department. Can create havoc and delay in management. So they need to understand the different different diseases, different diagnosis to a different department, and sometimes it can create havoc in reality. If I can say here, 1 month history of lumps all over his body. So if this patient referred to department of because there are several departments can involve here. History of lumps all over his body can be a problem of hematological, so they will go to the hematologist. Or is this neurology, history of lumps all over his body? You can have a disease under neuro, the situation whereby it's really involved with feet as well. So are there any terms the student need to identify? If they don't, they go and find. Identify the chief complaint. What is the facts here? Fact here is the young man presented with lumps all over body. So they have to come up with the what is meant by lumps, or is this lymph nodes? Is this lumps and bumps? Is this not related to any other? The patient may complain certain things, but when we look at the patient, we find something else. So identify the chief complaint. It's a facts here is young and come with lumps all over the body, which could be lymph nodes here. Discuss your ideas or hypothesis, dalamnya ideas, by integrating relevant basic medical sciences and clinical sciences knowledge. So ideas relevant into the case. Please note the ideas or hypotheses are not necessarily confined to the diagnosis. So the ideas and hypotheses can be in terms of the management, in terms of the understanding of the consequences, the complication. So it's not just what's wrong with the patient, what is the diagnosis, but it's also to understand and to manage and to investigate the patient. So this is some of the ideas, hypotheses that they have the pre-existing knowledge, and they try to integrate with the clinical as well. So in terms of problems in nursing, so they have the prior knowledge. Every one of us had the prior knowledge, and integrate this to come up with some hypotheses. So facts, ideas, what you need to know. So the student, the facilitator can facilitate this. Further information needed in the history and give reason. So if let's say we think about this is probably lymph node enlargement, the whole body. So if it is lymph node enlargement, we wanted to know other information such as Does the patient having fever? Does the patient having bleeding? Does the patient... So all this information, we put it in. They have not come to the to the clinical yet, but the problem here is to teach them and to lead them to get to know more what you need to know. What are the systems they require? For instance, if this is this is the case of lymph node, lymph adenopathy. So their basic sciences must require must know about the reaction or the function of the lymph node. During the discussion, identify primary learning issues in the basic medical sciences and all clinical science knowledge that the group need to find out more in order to work through the case. So other issues that require further research can be categorized as secondary learning issues. So the primary issue is about what is this lump, and the secondary learning issues is how to investigate this, how to investigate and how to manage. So if let's say investigation here, what the student needs to know is about sending the full blood count, full blood picture, another specific test that they need to know in order to help them in the diagnosis and as well as to manage the patient in the treatment. So these are the students' tasks, and we need to facilitate them to achieve the learning outcome for this trigger one, and we help the patient help the student facilitate, and they will decide on the task among them. Okay. So kalau that you just do some scenario trigger, and you can always put the student task here. And actually there's the module, another is actually facilitator in PBL, what need to do. But I didn't have here. I just bring what usually the facilitator will do. Then come the any question from here?
Yes, there is a question in the chat box from Dr. Siti Fatima. Doctor, how about foundation subject like chemistry? What kind of trigger?
What kind of trigger should we give to them? Yeah, interesting. Yeah. Now, what are the problem with chemistry? What are the issue that they can have? Not just about the diseases, but what is the problem if we have a problem in the, let's say, gas. So I can say that trigger number one, we can always say that there's a triggers, for instance, macam there's a school caught on fire, so because of some minor explosion in one of the kilang, one of the places. So you are, as a chemist, you need to assist in the investigation, right? So that's one of the things. So the problem occur, but must be related to how do we want to make sure that the student, as a chemistry, as a when they are when they become when they work, what are the profession or what the situation that chemists will be asked to help. And another thing that you can use the chemist in the forensic cases. forensic cases. So when we construct the trigger, and then we ask them, we put some terms. Are there any term that you do not understand? So in order for them to understand what are the solution that they need to use to test. So forensic case is one of the chemists will be called, right? And sometimes if they work in the plant, the gas, so they need to test some of the water quality, they need to test on the gas in the plant, oil and gas plant, the corrosion in the piping. So all these things will involve the chemist punya job. Then they will learn. I need to understand some of this. Is it relevant? That's the thing that I prefer some interactive sessions. So the online is definitely make me feel like I'm talking to myself. Right? Every day, look at and talk to a patient. Sometimes they are having some loosening. So bila dapat peluang talk to the give talk, so the interactive. So I hope it's helping you, Dr. Fatsiti.
Yes. Thank you very much, Doctor.
So you know how to do PBL now, construct?
Yeah, because we've tried a few years back. Because I'm teaching in the in Gambang in the Center for Foreign Studies. So we teach, for example, in chemistry we teach topics like gas laws, and then reaction kinetics. So we tried this, but then yeah, like you said, because when we went for the training, the trainer said that the problem must be a real problem, a real problem in real life. So we did, yeah, of course we have to do research on our own. So we have to look for sort of we have to search internet search, for example, problems that might arise in like you said, in real situation, for example, as a chemist, things like that. So we did that, and because and then the time usually I want to know how many percent do you think we should give to the students? Let's say if the continuous assessment is 50%, what do you think? How many percent should we allocate to this exercise, this PBL activity?
I think if you have several other modalities of assessment, and you look at the time that you have invest on that exercise. Contohnya the lab, they have the lab as well, right?
Yes, they have
the lab, they have this. So if more weightage on the lab, so they should be given more they spend more time teaching learning in the lab. They should be given more as compared to PBL, maybe a few hours, something.
So is it right, Doctor, if let's say for the students at our level, when they search, they I think they can only do an internet search. Is that enough for the students level? Let's say if we give them, like, for example, 5% or 50%, 5%, is it all right? Is it okay for their, in terms of healthy and all that?
Yeah. Oh, okay. You can decide, I think, because it based on our learning alignment, as well as the because we are using the outcome based, right? And the assessment, if let's say we want them to do internet search and they discuss among them, I think it is reasonable. The only thing is they are more creative here. So for instance, They get some resources from the maybe pakcik or whoever they think that can give them to
For
learn.
example, like real
Yeah.
interview with the experts, like the
Yeah.
real life experts.
Yeah, I think they can do because of, yeah, sometimes I do receive a call from some Form 5. Yeah, I mean
I see.
from they said we wanted to ask this, and so they did. Actually, I do have, especially on the mental health issues now on the rise, can. So it is okay. I mean, how do they get the resources, the terms itu? I think must be realistic as well lah. Yeah, and look at the learning, how to say that,
learning outcomes.
Yeah, the learning outcomes. And if let's say they can talk to the other people, I mean, another soft skills that we try to, they learn from that.
Yeah.
And actually the students are very happy. Their life is so dull sometimes. So when they get to do some, and you'll see more in the project base, you can yeah. So if they can participate, they can learn, they can go this one. This is much more engaged in the learning sebenarnya.
Yeah.
Yeah.
So
yeah. So I think we should try to do this problem based, but get the real problem as a chemistry, as a person, as a part of the team. Can?
Yeah. Thank you, Doctor.
So for corrosion, what are the things happen during corrosion? So they need to understand. Maybe I don't know what is corrosion in the plant, can, and then they try to solve according to their cognitive level. Apa yang kita nak? Remember our
they understand that the reaction between iron and oxygen and air.
Yeah. And then whether it's at the C level, C5 or all this kita punya taxonomy dia tu.
Belum taxonomy.
Yeah. So it is quite interesting when the student get to work on this real thing. Otherwise, what are the thing? Then I don't know about other student, but the medical student, we try to bring them in the beginning to see the hospital. We have the hospital visit. We just to make sure that they are connected to the from the theory and the practical.
Yes.
Yeah. Okay. Thank you.
Thank you very much, Doctor.
Right. And similarly goes to Annie. So we picture what is our role in later on, and we will use all these things. Otherwise, the student maybe will say that, what is the purpose of me learning of this thing? Nowadays, I see that some of our students, they are the course is engineering. Then this happened to many of my friends punya children. So recently I got to ask, how you are working as you are a petroleum engineer. So what are you doing now? Oh, I'm managing McDonald's. I said, oh, okay. On top of that, what have you learned? And because he's a petroleum engineer, of course, he sometimes feel like he is not using it. But because of the learning that he has, I mean, the leadership skills, the management, who is this, who is that. So from that soft skill and that leadership skill brought him from McDonald's in the management. Now he is supervisor at the one of the companies motor vehicles, the motor. So I guess sometimes it is quite frustrated for the student, because they say, what's the purpose of me? But we always say that, okay, the learning experience, blah, blah, blah. But if we can give the problem, the real problem when they as a chemist, when they work later on, so it's actually connection. So it triggered more interest for them. And let's see what happened after they graduate. But we know that this is the thing that probably can engage them in learning process. Okay. Siapa tadi tanya? So this is the trigger one. Let me stop the sharing. If I'm too slow, just let me know. I can make it fast as well, but I want the learning, and it's also part of the revision to me as well. Trigger two. Now, what is the trigger two? Trigger two we give to the student as well, so that it will answer some of their question. One of the learning needs they have. So, so we give more additional information for the student. Trigger two, we say blah blah blah. I think some of the question that probably we want the students to know, some of the things that they need to know is about the history, the situation like, because they need all this to synthesize and to analyze. For instance, like started with one lamb, notice another lamb. There's no fever, giving a condition that this could be infection. The terms of loss of appetite, night sweat, or weight loss is a symptoms for TB. Okay. And
are
also,
you sharing the screen? Tak share lah screen.
Tak keluar. So short sendiri saya ni. Okay, jap. So that's share. Nampak tak?
Nampak.
Okay. So, sorry lah, my technology ni lambat sikit, slow a bit. Right. So each of the information here, actually we expect the student to gather all these things before and the question, because they have a set of pre-existing knowledge, and the history that they need to remember the task. What are the further history that you are required, further information that you required. So if let's say we reconstruct the corrosion at the gas plant, so what are the further information that the students required to get in order to make some diagnosis about the issue, and also it's not just for diagnosis but also how to help the team. So at the hospital, both the and wife in Tioman Island 5 weeks ago, they stayed in chalet. They had grilled fish and rare barbecue dinner for 3 nights. Rare barbecue. Fact, stated there were many chickens and cats roaming at the resort. All this information is actually to help, and the couple gladly fed the cats with their leftover barbecue lamb and beef. When asked further, family members who went to then was taken seriously and had to be admitted. So looks like some infection here, but the prominent. So the students, because they are medical students, so they need to get some of this. Why the history here, like the history of malignancy here, no history of malignancy. So we expect the student when they receive the first trigger, the next question that they wanted to have is malignancy, because of one of the differential diagnosis for that problem. One of the issues or learning issue is the patient could be having a cancer, such as lymphoma, because lymphoma presented with multiple nodes, multiple lumps. So that's why it will, if let's say the students say, I need to know whether the family, the further history about malignancy, why? Because one of the things that comes into their mind is this could be lymphoma, and history of lymphoma in the family will predispose a person to get greater risk of developing lymphoma. So all this information we expect them to list and to learn and to get. I mean, now we are giving them the answer based on what has come into their mind. Why sexual promiscuity is here? Because of it's also related to sexual promiscuity means infection, especially HIV. So HIV can be presented with AIDS, and obviously they will have lymphadenopathy. So you can, if you are coming from chemist, from this, so the idea here is what are the further information that you require to help you in diagnosing and managing the patient, and solving the issue. So the acquisition of the further history, and this is where they can talk, they can read, they can ask. There's lots of literature on the search online, and also if they happen to interview a person or a doctor who has experience, so it depends on their creativity as well. Okay, so at the end we give you at the end that we give actually only 4 triggers that we give to this patient, to the student to solve. Trigger 4. The last trigger. Okay, so this is the students probably said they come up with some investigation that they wanted to know more. They wanted to know about hemoglobin, hematocrit. So we gave them the answer, and later on they will student task, same. Are there any term that you do not understand? Discuss the investigation results. It's a fact. So discuss further ideas and finalize your diagnosis. During the discussion, identify key. So each of the packaging must have facts, ideas, key learning issues, and secondary learning issues, and also Islamic perspective on man and animal living harmoniously. So this is also the task. This is a specific task that we ask the student to get. And with all this information, they're going to present their findings and provide the solution A, B, C, and what to do with the cases, what to do with the problem. So case by case. Okay, so that's one of the example for PBL. We go back to slide about rubric tadi kan. Rubric. Okay. So assessment of PBL, of course, formative and also summative. So the formative is usually occur during the discussion, and sometimes some of the formative can be done in terms of oral, or sometimes the students can do some reflection. So the reflection can be in the oral form or in the written form. And summative is where how much you want to give. The rubric ni nampak tak ni?
Nampak,
Can you
nampak.
see the screen? Okay.
Nampak, nampak.
So I'm trying to give the example. Can I give the example later? How together with the because of our part as a lecturer, memang how much we want to give, where is what kind of rubric that we can suggest. But I think I need to get it somewhere from my file. Dia ada somewhere dekat apa ni, the article here, you can refer here, rubric score. But what we do in our basic medical sciences, I can share the rubric after this. Okay, I think that's my end of PBL. And then we shall take 5, Dr. Wira.
Sure.
Ah.
So
So we will come back after 5 to 10 minutes. The project base is more or less group work as well, but there is a little bit different from PBL. But the assessment still some of the area that we want to assess, some of the rubric can be almost similar. Stop share. What time shall we meet, Dr. Wira?
maybe 11:10. Is it
Okay.
okay?
Okay.
11:10. Yeah, we come
Right.
back at 11:10.
Okay, thank you.
Inshallah. Thank you. Dr. Nora?
Assalamualaikum.
Waalaikumsalam. Okay.
Okay. Assalamualaikum. Can we
Waalaikumsalam.
continue?
Yes, sure, Doktor. Silakan.
Okay. Alhamdulillah, we can continue, and we will have around this one. We continue with the project base unless there any question or thoughts. Masih tak ada pun. Last day of Hari Raya today. Okay, I will share the next slide. Okay, we shall move to our okay, this is some of the example, yeah. For the if you can use for the PBL. But how appropriate was the search strategy, comment on how to improve. But you can always improve according to your needs. This is just an example, but for the criteria, they can put organization, linkages, integration, discovery, but it's always go back to our learning outcome. For the medicine, they give a very, the example tu agak loose juga lah. I try to show because the form, the assessment form got students' name. Need to modify that bit, but let's go for project-based learning as first. Project-based learning is a student-centered form of instruction based on 3 constructivist principles. Context-specific and learners are involved actively to achieve the goal through interaction and sharing of knowledge and understanding. This is actually the definition that I copied straight from the COCO in 2006, but it's a problem within real practice for meaningful learning. So what is the difference between project-based learning and just a project and problem-based learning? There's in project-based learning, students engage in knowledge construction by completing a project. It is learning by doing, or learning happened during the project. And this was advocated by John Dewey in 1980s. With the philosophy behind is, it's just not something to do, but it's also something to learn. So the principle is learning's context, just not say active involvement by learners, and to achieve goal through social interaction, sharing knowledge, critical thinking, and lots more. So what is the similarity and differences between problem-based learning and project-based learning? So I think the real differences is in a project-based learning, you must have a product. There's either artifact or product. Whereas in the problem-based, we have a solution. So project-based learning is based on the inquiry learning, authentic questions, explore deeper to get new knowledge and deeper understanding. It's also part of the experiential learning. A student learn through real work experience. You have to collaborative learning and engaging with real problem with analyze, synthesize, gathering information, and use of technology as well. how to put this way. We have some question, and through this project, we try to answer that and to get that. And the hallmarks of project-based learning is a question driving. I mean, you drive a question. What is, and we set a learning goal. What at the end of the project, what the students need to get or need to obtain, and it's involved educational activities, collaboration among learners, use of teaching technologies, and there must be a tangible product. And the assessment will be based on the performance based usually. So this is the difference between PBL and PJBL. Problem-based learning process. Project-based must have end product apart from the learning process. Undefined problems present to real life problems. So we need to have one end product, and usually there's only one product at the end. The problem base is more than one solution, and solution presented to class and involves evaluation and reflection. Same evaluation and reflection. There's also there's encouraging about the communication for the academic skills and soft skills as well. So in order for us to produce one product, we have to have some skill. It's a structured project based. When we do a project, it's not just doing a project, but there's always the structure behind it for each of the process in order for us to produce the product. I think this is about engineering, engineered something. But for the problem base, you can have 2 to 3 solution, but the thing has already come with a problem. This one we engineered the new things, engineered something. So that's why project based is very famous among the technical course. So 5 key features of project based is driving a question, exploration of this question by the student for more ideas, authentic. Students, teachers, and other collaborators to find solution. Students are scaffolded with teaching technologies and presentation of product or artifact. So what is the theoretical background about underlying the teaching learning method in problem-based, in project-based? The science of learning here is actually involve the active construction. So we construct, we understand the meaning of the life experience that we've gone through. Construct and reconstruct continuously, interact with surrounding and connecting the new and old idea or knowledge. And there's also the situational learning. It is a real context. I mean, you work to produce something. Student takes part in designing, students appreciate the values, the meaning of the activities, and the better generalization of the concept. Perhaps the portfolios is helpful some of the students to write down what in portfolios here, maybe in the group as well. So a group of people, they can have individual portfolios about how and what the process, the learning process has occurred or not. So it also involves social interaction. So learners understand through sharing and debating their ideas. I think in the problem solving also we can have similar like sharing and debating and what need to do, what might not need to do. However, the biggest differences is you must have something at the end of the project. And apart from social interaction, is also good for cognitive tools and amplify what the students have learned. And the graph in terms of software or in terms of multimedia documents, so more and more engaging the students. And it is, I guess, more thrill for the student, because they are producing something, whether this is have some monetary involvement or not, but there is something that they can show to the lecturer or to the people. So how do we do project-based learning? So it's basically, it is driving questions. We need to know and we inquire to know the communication, technology, literacy, collaboration. It is the voicing and the students who make their own choice. And of course, there will be some feedback and revision on their product and the product presentation. So lots of reflection occur as well here. Lots of try and error when they discuss in the group. Oh, actually, I have another. I'm going to give example, but I put the stop share here. Yeah. So it is started, it's a student-centered, started around 1990s. It is an instructional method. Sorry. Here. We go to project book. So the benefits of project based is students engagement and increases. Some of the research shows, especially in the medical course, the benefit of project based increases empathetic feelings towards the patient. When the project is to go to the ward and start talking to the patient, so you can see that the students involved are more empathetic rather than reading the books and not seeing the patient, not listening, not so. It is integrate different disciplines. So many disciplines work together to produce a product. promotes motivation, communication, cooperation, and problem-solving skills as well. And then it's also give the chance for the students to apply the knowledge in the form of producing something. Okay, this is just not. We have discussed. So how to approach, what to do in terms of basic principle of doing the project base is some researcher put as 7 steps, especially in the technical, and some put as a 5 only. So, but what are the steps involved is, what is your formulation of the expected learning outcome? So what do we want the student to get at the end of the teaching learning method? Understanding the concept of teaching material or some form of skills training. What are the skills that need to be trained throughout their okay, so what is the design for the project team? What is the students need to propose their project, and they need to divide the task among them. And lastly, the presentation of project report. So what are the skills training needed? What are the design project team? So some say that the problem-based learning and the project-based learning are suitable for the tertiary education. However, the project-based learning at the minimal level has been used even in the primary school. But of course, the level of knowledge that they have, they are expected, is not as high as in tertiary education, tertiary teaching. I mean, some of the schools now, even in the kindergarten, they start do some project. It's quite interesting. When you go to, what is the project? So actually, I remember one of my grand niece, a grandnephew. So the project that he has to do is about the project that has to do is the plant the one of the flower, yeah. So he has to wait to see the growth. So it's actually a simple form of project base. At the end, you can see the product is the plant shows the shoe, and he has to take care how many times that he has to watering the plant. I guess it's more and more even in the kindergarten when they need to do some project to enable or to expose or to learn some of the skills needed in the learning as well, in promoting the learning. So I think it is much more when we do the project based, we have to look at the level as well. Maybe the first year project will not be the similar like 3rd year or 4th year or final year project. So I think UIA has final year project, FYP. So I'm not sure whether this comes under because it also can be under research project. So project proposal, task execution, and presentation of project report. So set up the learning goal, learning outcome. For instance, like in my case, learns about the disease. The goal is the student need to learn about ischemic heart disease, or maybe in a dietitian, the goal is to know what is a balanced diet. So select specific problem or question So what is the causes? What is the sign and symptom? What makes balanced diet? So students independently exploring the resources to answer the questions. So we give them the questions, we give them some project, and let them also brainstorm and come up with certain ideas. So in order for them to learn about ischemic heart disease, they must know what is the causes, what is the sign and symptom. So what is the project name? Project name may be something else, but the learning goal is the bigger one. The specific problem is what? How do we how can we devise, or we do some research in terms of the outcome is perhaps management of ischemic heart disease. Is my thing. I give an example, better ones, because currently in my department, psychiatry, we have psychoeducation project. The learning goal is actually for the students to understand certain diseases, and we make it in the form of project for them to produce psychoeducation materials in whatever form. It can be a demonstration oral, it can be a poster, it can be the electronic information about certain diseases. So at the end of the class, at the end of the posting, they need to present their finding for us to evaluate. But the project is psychoeducation project. So what is interesting about this project as well, it does increase our copyright because of the ideas, and the material that they produce is something which is it's not, it is authentic. I mean, so they got to learn as well as they got to produce some in the electronics, some in the video form, some in the TikToks, whatever they can. So we will evaluate them based on some content, and for the content and how do they deliver, so according to their project. I want the original thing is actually I want them to learn several concepts, several ways of, and they got to do the psychoeducation material, and they can prepare this and present to the public as well. Select specific students independently explore the resources to answer the question, and they can plan the method to facilitate, such as get the resources, how to present finding or final piece, what are the assessment criteria that we want to assess, because the student needs to know in which area that they are going to be assessed. After the 1, 2, 3 step, the next step is presentation or demonstration of the final product. It can be a class presentation, it's learn from peers, getting feedback, learn how to listen and respond to critical feedback. It must have rubric and peer evaluation so that it becomes standardized, and it is equal chance for each member. There's no for equal chance for each member to be presented, not just present. If they plan to present, somebody might want to focus on the multimedia, so they have a different tasks, so you consider that is also part of the evaluation. And then lastly, they have to do reflections. Reflection can come in terms of written or oral, and also must have a feedback from instructor. They can do reflection in the either in the oral or card or podcast or etc., as long as they can reflect on what they are doing and what are the learning. So what is the assessment of the project base? Is it formative? Is always ongoing? We give them feedback, we give them some reflection so that they can improve along the the project. And what about the summative? Summative actually is a performance based in terms of the either oral presentation or there's a exhibitions. I mean, the students decided to do some small exhibition for their product, or can be those who likes to be an actor, so they probably suggest the role play to share their report. I mean the feedback. And as usual, we must have the rubric for evaluation, which can be in the form of authenticity of the idea, the education, and we give in the Likert scale. This is a project-based evaluation tool. Some of the idea, this I copy from Chang CC. He suggested some of the some of the ways that we can put in our rubric. Assessment tool for learning effectiveness of in one project. They make it one project and they try to use some of the questionnaire here to show what are the things that we can evaluate after the what are the things that we can evaluate or assess once the project completed. So the experience perception, the self-efficacy out of this project based, the learning motivation, and product evaluation. This is assessment tool for learning effectiveness of project-based evaluation tool. So of course, this is quite generic, but still a big topic. So you can always make it more itemized. What does it mean by for self-efficacy based on the project evaluation tool? How does the project improve or help in the self-efficacy? And what about the project? Remember earlier on I said about problem solving. It's actually motivate the children, the student to engage more in the learning activities. So in order for us, we can actually construct from this construct the suggested content: flow experience, self-efficacy, learning motivation, and product evaluation. I would like to show my project in a simple project that we have for each of the final year student. Okay. Okay. So we have the this project psychoeducation. Our goal is for them to learn about certain diseases, but we make it more focus on how do you learn about schizophrenia. So in order for them to understand schizophrenia, they have to do a psychoeducation presentation or project. At the end of actually just 4 weeks, 4 to 5 weeks project only. For the first, they need to get some information in a group, like a small group, 4 to 5 people work on this project. So let's say although they are doing the project together, but we assess the student individually. So the fact that they are doing some discussion, we give some feedback on that, more on the formative assessment. So this is simple rubric when we have the presentation of the psychoeducation project. So they need to, the project that we give different from this block to the next group. So my goal is for them to do to learn about schizophrenia. So they need to do one artifact or product. Then they choose to be a poster. Some of them poster, some of them YouTube content. And in order for them to understand about and to tell the public about schizophrenia, they need to understand what is the signs and symptoms of schizophrenia. What are the treatment available? What are the side effects that patient can have? So these are the questions that they need to answer, so that they give the good psychoeducation. So they learn and they tell the public. So unfortunately, I just have this presentation of marking sheet, but each of them need to write some reflection in their logbook, which is we put it as just a formative assessment, not the summative assessment. So the summative that we give is based on the final product they present. I need the marks actually, how much introduction, content selection, organization, transitions, and conclusion. And how do they present? Physical presentation and deliveries, the length, the visual aids, the vocal qualities, the eye contact, the gesture, audience engagement, appearance of presenters. So we give some marks here. I know that it's not easy to make some rubric because of it's also based on some subjectivity, but we try to be objective in this case. So you can the lecturer can read here, or they can circle novice to exemplary. So the marks that we can choose here, let's say for the introduction of the topic, if it is exemplary, we can put 4. But of course, what do we mean by exemplary? How much we can they put in the introduction? Of course, each of this detailing will be lots of issue that make time. So we do the minimum so that at least it is standardized when we do the assessment. When we give the report, the marks for the students. This can actually match with our program learning outcome or course learning outcome, whereby the students can know or can obtain what is the good visual aids, what to put in their slides. And when they give they choose recently my group choose to do psychoeducation presentation to the public who is waiting for their turn in the clinic. So we will observe, and the patient is a real life engagement. The patient got to ask the student on what do they do, what sort of things that they need to do if the symptoms reappear and relapse. So students enjoy that. In view of the limited time, the limited posting, they only with us for 6 weeks, and the 7 weeks is the exam week. So that's we can do more in terms of the project. For instance, put it in a bigger picture, go to the community. I think that year 4 of public health in psychiatry, in medicine, they need to go and do project in one of the village, one of the kampong, and to fulfill some of the learning outcome and learning needs. So you can derive your own rubric and based on your learning outcome. Okay, what about the rubric that being used here? That's the rubric that being used. Okay, I think this is I will show you, but I think this is quite confidential. The rubric for problem solving that I promised to show, the one that I showed earlier is how you can construct your rubric. But for medicine, I didn't show here because actually there's a student's name. But the area that they put is knowledge, task performance, communication, attitude, and overall. So out of 50, they give 10. For knowledge, they give around 10. The marks is 10. Task performance is 15. The communication is, at the end is total up, is 50 marks. Yeah, 50 marks. I couldn't get their real rubric, but I'm supposed that you can make the presentation based on the content and based on the learning outcome that I showed just now is for the project base, the final product, the presentation. But the in between what happened, we give feedback and for the feedback for the student through formative and the summative. It's not easy when we try to, I mean, we cannot measure what is attitude. So perhaps we cannot tell that, okay, how good is the student? How can we show the attitude to give mark, except we can use that and any other measurable one. attitude, professionalism, sometimes it's good just to be a formative assessment. I think I have no more. Let me see the slide, last slide. One thing about any project group or project based or problem solving based, or even individual, because for us in clinical, I'm the clinician, so we teach the students. For me, they come to me at year 4 and year 5, and they always in group. We divide them into groups. So for bedside teaching, for the project, and because it's only small group of people, that around 25 students, 25, 30 students, so we'll be divided into among the lecturers. So in order for us to have the reliability of the assessment, that's why we use the rubric. So this is the evaluation that can be used for project based. Yeah, you can devise from the rubric from here, as well as the one that I presented just now, the example from psychiatric department. And the important part for me is the element of reflection. The student must be taught how to do reflection, the good reflective. And the reflective can be writing, can be in the oral form. Some of the courses do give marks or summative to reflective writing, which is still debatable among medical education, but to be able to give mark to the reflective writing, the consensus and the rubric must be in place in the department, among all the lecturers, to ensure the reliability, because most of the time the reflection is done for formative assessment, but some do take it as a summative assessment when the students write in the form of reflective writing, or some of them do in the podcast, or you can decide how to give mark. But for our department, reflection is just for part of the formative assessment. So, but many of the students don't know how to do reflection. It can be oral, so it's very simple. We teach the student to evaluate. So what is it? What is it is to describe whatever event, people, what are they discovered during the process, the learning process, the process of coming with the one artifact or the product. So we teach them to describe. For instance, when we say what is it, it's just describing. So describe when. Why do we want them to describe? So it becoming more meaningful, and it becomes more mindful at that moment, at the present. So we remember and try to describe. So when my friend, for example, a student say, when my friend tell me that my point of this is wrong at that particular time, what happened is initially it's just describing. So when, what time. So at that particular time, I just had a bad time with my friend, the friend. So I went to the discussion. So the students are describing. So what? So what? So when my friend said and did not accept my idea, I become angry. So that is description. I was angry. So what? What is that acceptable or not? So what? So the students will say that I was angry, I was unhappy. So what? However, when the what come the analytical. However, I need to know about this. I need to learn how to improve myself. If I didn't learn this, what is the magnitude of the problem? If I didn't learn how to accept the criticism, there will be a problem to me when I want to deal with the real life situation when I work. So they just do. So what is, it's about what the description, what the event give them something affection or cognition. So they think, so by right I should be able to this, I should be doing this. So what's next? So what is it? So apa? What is, so what is matters to you, and what's next? So because of I feel that I am easily upset with comments or critical, I want to go for anger management, or how to become more mindful with my own feelings. So what is the next agreed plan? Whether is there any behavior change, or I need to remove. So what is it? Descriptive is when my friends pointed out something that my teacher or my lecturer say that I think your concept of physiology is wrong. So what? And then I realized that if I didn't go through and read properly, I didn't understand, it might be danger towards the patient. It might be danger. I might be failing the exam because I have a wrong concept. So what's next? I'm gonna read more about this. I'm gonna go and talk to the people in the real life. So that is how the student do the reflection. This is a simple way. And we teach them every time, not just because of the group work, but also whenever they finish their some projects. Yeah, I think that's all I'm gonna share with you all. Sorry, I always feel that if I have more on the face-to-face, we can engage with more activities, but I can't do that since we are doing this in the online, and it's always not that easy for psychiatrists because we really look at their behavior. We sometimes observe and give we ask for some, what makes you do this, what comes in your mind. Now that I cannot do that with you all, but I would love I think I enjoy sharing my experience here. If any question, it's 12 now. I pass back to Dr. Wira. I hope we can get some of the objective answered, the learning outcome.
Okay. Any question from the floor? We wanted this to be online, Doctor, because we want more audience. Today we
Yeah.
have
How many?
today in the morning we have reached about 80 participants.
Mashallah, mashallah. Yeah, I believe it is not just coming from the sciences, right?
No. I can also see from COED, from KLM, I think.
Yeah, and I feel very small in front of this co-ed because they are the education, they are very well versed in the assessment. And I'm still learning from my colleague in Kuala of Education. The assessment, seafood, many there.
Yeah. We have Prof. Sari, Prof. Ainul, Prof. Nolida.
Yeah. Okay.
No question from
Yeah.
the audience? Pukul 12 kan? Dah lapar. Okay, I think that is it. Thank you very much, Dr. Nora. It's a very interesting sharing. Now, we hope that we can apply. Now, our assessment is not just writing down everything. We can have our assignment assessment in the form of PBL or project based. With the knowledge that we have today, inshallah, we can design such assessment or such activity in our class to get more engagement from our students, inshallah.
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 And we did that. And in medicine, I mean, I prefer them to work on. And in fact, the future medical doctors, the learning, the future, if the medical education, they said that the students must be engaged and take part in their opinion. This is what we have been doing. As a learn, because medicine is like the apprenticeship as well. The way that we train our students.
I think when students engage, we can they understand better, right?
Yeah. And this is proven by research about project based has more engagement from the student and the fun learning. And I think the generation now, you must remember, generation now is outcome, it's an output punya. They want to see, they cannot wait. They are driven by outcome, output. You can't give me the answer, I'm gonna get the answer from some. So that's why there's a challenge in our teaching now.
Yeah.
But thank you very much, Dr.
Thank
Wira,
you
for inviting me
Sure,
for this sharing session.
maybe we can take a quick group photo for a while. Everybody can just turn on your camera.
Yeah. If I cannot answer some of the question, you can always drop to my email. The email for my email is accessible even to the patient. So sometimes because on the website, the UIA website, our email is available, and sometimes got tracked from the email as well. But it's it's a learning process for us as well, how to handle the technology nowadays. Nothing is private now.
Yes.
Yeah. Okay.
Maybe we can take photo first page now. Okay. 1, 2, 3. Okay, first page. Then second page. 1, 2, 3. Okay. Thank you, everyone. Thank you, Dr. Nora. Jazakallah khair. Let us end our session today with Tasbih Kafarah wa Suratul Ams. Thank you so much. Thank you, everyone.
Thank you, everyone. Thank you, Dr. Wira, Mr. Hilda, Prof. Nora. Thank you very much.
The bosses are here as well. Dr. Mira. Prof. Mira is
I'm a learner, not boss.
Okay. Thank you.
Take care.
Thank
Have a
you
nice
for
day.
having me.
Thank you.
Don't forget to fill in the evaluation form later, yeah, everyone. Inshallah. Thank you, Dr. Nora. Hope to see you again.
Inshallah.
Inshallah. Assalamualaikum.
Salam.